September is Childhood Cancer Awareness Month, and our medical contributor, Dr. Ogechika Alozie from Sunset West Health, joins me now. Dr. Alozie, what causes cancer in children?
So first of all, I think I will give the sort of asterisk that I'm not a pediatrician and I'm not a pediatric oncologist. But when we think about pediatric cancer, it's not really known. Really about 5 to 10% of pediatric cancers have a defined cause. It's usually inheritable or inherited, and a lot of them have genetic markers on them that can be treated. This is not necessarily that conversation, but there is a pediatric vaccine that we give to kids between 9 and 12 that can actually prevent them from having hepatitis, or oh my goodness, HPV, which can manifest later on in life. And so I think that's important to call out, not a cancer, but a pediatric vaccine.
All right, now what are the most common types of childhood cancer?
Well, the most common type is leukemia. Right? And so again, we talked about September being Pediatric Cancer Awareness Month. The most common type is leukemia. I think what's important also is that we are lucky and blessed. Not every community has a children's hospital. We have El Paso Children's Hospital here, and so I think that's important. We have people like Dr. Carcamo, who's available there, and they treat cancer. When you think about, well, we talked about the most common cause of death in kids is childhood cancer. The most common cancer is leukemia. And so that's a blood-borne cancer. You know, one of the things that people often ask me, well, how do I know if my kid has cancer? They start to act differently or they behave differently, whether it's persistent fevers, a fever that goes 3, 5, 7 days and doesn't break. Kids that all of a sudden start to have a lot of stomach issues, nausea, vomiting. They may be tired all the time. And again, if your kid's playing sports all the time and they're tired, maybe not the same thing. But again, if your child's overly exerted themselves or overly fatigued, important. And then a rash is important. The most two common types are ALL, which is about 3/4 of that, and then AML as well.
Now, how do you treat childhood cancer?
I think the good news here is that majority of childhood cancers are treatable. About 80% of kids that get the right treatment actually become long-term survivors. And so when you say cost effective, I'd like to say, well, cost effective is because if you treat a kid, they can live hopefully till 60, 70, 80. And so that money that you put in up front, I know we hate to talk about that, is actually saving their life and making them productive long term. The unfortunate part is that about 1/4 of all the families that have a child that has cancer actually spend their yearly savings on that. And so that's why it's important to sort of talk about some of the other resources that we have in the community.
And speaking of resources, where should parents turn for help?
Yeah, so I've already talked about El Paso Children's Hospital. Cindy Stout and her team do a remarkable job. Talked about Dr. Carcamo. From the El Paso Children's Foundation, again, raises money specifically for El Paso Children's Hospital. But would like to call out Candlelighters specifically, a nonprofit that does a great job of focusing not just on the patient, the child, but also the family, whether it's mental health counseling, whether it's activities like one of the camps that they put on. But if you're out there and you're asking, well, what can I do about this, Dr. Alozie and Mark? Donate. I think that's important. I mean, and a lot of children's lives and well-being can be saved by that.
And before we wrap things up today, there's a big event next month that's going to raise money for pediatric cancer research.
So St. Baldrick's, now I can't take part in this
I was going to
I
say.
have no hair, right? But they have a head shaving event, and this is actually an annual thing, and it goes to raise money again towards the work that the Children's Hospital does towards treating cancer. It's on Saturday, October 15th. It's at the Southwest University Event Center. You can see it on the screen. I think, again, if you have a loved one that suffered this, if you're interested in helping the community, I think one thing that we try to do, Mark, is what can you do? This is one of those things you can do.
All right, Dr. Alozie, as always, thank you so much.